Sure, Benedict.
Okay, thank you so much. I think we just have a few introduction and then while waiting for the others to join. So let me start. Hi everyone, good afternoon. Thank you for joining us today. Uh, my name is Benedict Majuk, the program chair for SP Juba sections and a moderator for this event. We are pleased to present this special visual rectangular lecture on managing driving risk in the new normal or new normals during COVID-19 pandemic. Today event will last for 60 minutes, 45 minutes for the sessions and 15 minutes for questions. Feel free to talk to us, any to ask any questions at any time. During this presentation, our guests will answer your questions. Before we begin, please allow me to present to you our Juba sections guest speaker, Mr. Godians Bianca. Godian Dianka is an SP lead as LLB. He holds a Bachelor of Arts, Social Science from University of Dar es Salaam, Tanzania. Prior to his current employer, he spent years with John Hopkins University, Washington, D.C. under Fulbright's program sharpening his trainings and development skills and acquiring cultural diversity. He spent his last 8 years with SLB oil and gas service company in HSE department serving in different countries including South Africa, Mozambique, Madagascar, Ethiopia, Uganda, and South Sudan. Mr. Gideon, welcome on board, and I would be happy to hand you a plot to start, and maybe you can add more so that the audience can have more about you. Thank you so much.
Yeah, thank you very much, Benedict and Edwin, and all the participants in this webinar. So, as I've already been introduced, and I'm happy today to be with you. And for those who will keep joining, we'll keep inviting, for this is a training session. And for sure, I'm not going to be presenting. I'll be more of a facilitator,
Thank
sharing
you.
and then listening from the wisdom from you and then your experience. As this agenda today is very common, but most people take it for granted. So it's very important, and SP did the right choice on choosing this particular topic. So I'll share my screen. Please let me know once you can see my screen, and then we kick it off. Okay.
Mr. Edwin, Mr. Share, can you share the screen?
Yeah, I'm sure.
You will be able to
Can
tell.
you give? Yeah, can you give me the host rights so that I can share, please?
You don't. You have the host. You can share.
Okay, now I think yes. Let me know once you can see my screen, please. You can see my screen?
Yeah, we can see.
Yeah.
Okay, in full mode, eh?
Yes, full mode.
Yeah, yes, in full mode. Yeah.
Okay, good. So thank you very much again for inviting me to share about the managing driving risk in new normal during COVID-19 pandemic. So I've been introduced. I'm Godian Dianka. I'm the HSE for Shilambaje, South Sudan, also supporting other East African countries, including Tanzania and Uganda. So basically today, I will not be presenting as I mentioned. I'll be more of a facilitator. So I would like to start with a quick hearing from the wisdom of other people, apart from Edwin and Benedict. How, ladies and gentlemen, why do you think this topic today is important? Talking about managing driving risk during the COVID-19 pandemic. Any volunteer, please?
Yes, Mr. Chair, can you share your thought on that question?
Yeah, it's open for the audience, right? So I'm seeing people raising their hands.
Yeah,
Okay.
you can give them chance. Eh?
Yeah.
Can you give them chance?
Yes. I think they can drop a message on the chat box for the moment.
Exactly. Then we can collect their inputs at the end as we
Yes.
are
Please
the
drop
participation.
your thoughts on the chat box and we can collect it later on. All right.
Exactly. Thank you very much. So I'll move on for the sake of time. So today I will share firstly starting with a safety moment. This is our first agenda. And then I'll go quickly on introduction, sharing key facts about driving in a COVID-19. Then we will see on WHO driving in a COVID-19 risk profile. Then COVID-19 trend and the update. Then we will go through the IOGP driving life-saving rules. As we are very familiar, way back last year, around May to July, the IOGP launched the 9 life-saving rules. So today we'll focus on driving. And then we'll check on the driving challenges related to COVID-19. So we use South Sudan as a case study, and then referring to other East African countries, just to be more practical and see what we can do differently to uh, come up with some prevention and mitigation measures on the driving challenges. That will be the same on COVID-19. And then I will share quickly on Drive Smart principles. And on this call, we are having one of our driving champion. He's from Kenya. That is Alex Njuguna. I just want to confirm if he's in the call. Alex, are you in the call? I see. Yes. Okay, good. And then we open the floor on Q&A, so everyone will have a chance to ask, share, and participate. The key important here is to make sure that whatever we are discussing are practicable, relevant, and then going to help our organizations and the community in general. Okay, so let's start with our safety moment. And the safety moment is about HSE leadership. As we understand, leadership is very important for everything, especially when it comes to HSE. We have to lead by example. So coming to uh, the question for this safety moment is, what is your canal? So we remember way back 40 years ago, if you remember, uh, some mining companies before the gas detection technology, the mining engineers will use caged canary as part of detecting any methane, carbon monoxide, or any toxic gases. So in case there would be any toxic gases, the canal would die before the level of the toxic gases reaches the mining engineers and all workers in the mine. Now, from this good practice, uh, we have to ask ourselves, what are the weak signals in our organization when it comes to driving and COVID-19 risk management? So the key takeaways we have to review and revert and come up with a stringent management plan and a management system on HSE management, focusing on driving and COVID-19. And by doing that, we will help the world and our community to combat both the driving accidents and the COVID-19 pandemic. So that's all about the safety moment. And I believe everyone in this call, in one way or another, is a leader or a senior manager or supervisor or a lead in a function or department. Now we have to take back as a takeaway to our organization. Even in individual level, we have to reassess the way how we practice and address COVID-19 and the driving risk. Okay, good. So let me quickly start with the driving. As we are very aware, driving is the activity that presents the greatest potential risk for COVID-19. When driving, everyone is exposed to any accident. and this can lead to serious injuries, death, or catastrophic, or loss on the asset or damage to the asset and the environment as well. Now, here are some key WHO facts related to driving. Number one, approximately 1.3 million people die each year as a result of road traffic crashes. This is a big number of people. And definitely, driving is the highest killer in the world. As you can see, even in the pandemic COVID-19, I will see the statistics. We have not yet reached at that level. And the pandemic just is now more less than a year. But for driving, every year, 1.35 million people are dying on the road. Fact number two, road traffic crashes cost most countries 3% of their GDP. So this is a financial loss as well. Fact number three, more than half of all road traffic deaths are among vulnerable road users. That includes pedestrians, cyclists, and the motorcyclists. So these are very vulnerable. And we can see even in our countries, this fact speaks the truth. Fact number four, 93% of the world's fatalities on the road accidents that are occurring in low and medium or middle income countries. Even though in other countries it's happening, but when it comes to low and middle countries, it has approximately 60% of the world vehicles. And when assessing the fitness of these vehicles, this is very challenging. You will see later that most of the vehicles in low and the middle income countries are of poor condition, vehicles that are not fitting for purpose. And another fact, road traffic injuries are the leading causes of death for children and the youth. That includes adults aged 5 years old up to 29 years old. So this shows they have an ability because of the tendency of taking risk and being a little bit careless. Okay, now coming to who is at risk. Obviously, socioeconomic status shows that more than 90% of the road traffic deaths occurs in low and middle income countries. Uh, and the traffic injuries deaths rates are highest in African region. So you can see Africa is highly impacted. Even within the high income countries, they are facing the same challenges, especially in socioeconomic areas or backgrounds whereby uh, the road traffic crashes are happening. Okay, now let's see some factors, the risk factors, and these are very like common, especially in our East African countries. Number one is overspeeding. Whenever there's any accident, after investigation, they will come to us that the driver was overspeeding. This can be due to human error or mechanical failure to the vehicle. Risk factor number two is driving under the influence of alcohol and the other substance abuses. As you can see, like today is Friday, it's a weekend. When we drive back home, you will see the difference. So people driving carelessly as it's a weekend, and some of them already under influence of alcohol. At night, the same. Even early in the morning, people are out from nightclubs or whatever they are making their life, enjoying their life. Then, unfortunately, they die from road traffic. Another factor is non-use of motorcycle helmets, seat belts, and the child restraints. This is very common. As like now, as we are speaking, we will find more than 60% of people driving motorcycles don't have helmets and they're not wearing their seat belts. Then distracted driving, like driving while and you are using mobile phone, texting, calling, or whatever, or distractions. Then unsafe road infrastructure, poor road condition, unsafe vehicles or inadequate post-crash care. And then the last one is inadequate law enforcement on traffic laws. So as you understand, in Africa, when you meet with the traffic police, the easy way, just give something and then you keep moving. So this is the inadequate law enforcement of our traffic laws. Okay, good. So that's all about the introduction on traffic. If you having question, please feel free to ask later. So now let's move on COVID-19 pandemic. And why are we calling it new normal? We are calling it new normal because, in fact, we used to work in a very free way of life, free lifestyle. But COVID-19 came to change our lifestyle. The way how we work is completely different. So the pandemic came to change us. Now we have to adopt working in a new way. That's why we call it new normal. So even right now, taking an example before, no one used to care about using sanitizers, mask, or being very conscious on hygiene, but the pandemic came to change. And in one way or another, we can see a big improvement even in the community in terms of hygiene compliance. Okay, good. Now on prevention measures, very easy, as everyone is very aware. Stay safe by taking simple precautions such as social physical distancing, wearing a mask, keeping rooms well ventilated, avoiding crowds, cleaning our hands regularly, and then coughing into a bent elbow or tissue. And then you can check more details on this. But the key important information here, we have to do it all. And so far, we can see people are changing and doing it all. Now coming to some COVID-19 triggers, starting with the epidemiology, measuring the risk level for COVID-19. We look on the epidemiology, mean that the transmission rate, infection rate, recovery, and mortality rate. Number two is COVID-19. We measure the risk level by looking into the government and the community compliance in terms of restrictions and the compliance as well. Then travel condition, restriction and compliance. Testing capacity, we are looking on government and the private testing facilities. Later we discussed on this referring to South Sudan, but as we can see, there's a big improvement on the testing capacities. Then resources, here we are referring to availability of thermometers, sanitizer, masking, and glove, and the other resources. Then the last one is the public health capacity. Here we're looking on availability, accessibility of healthcare providers. So more details you can get from WHO. Now let's refer to the COVID-19 global updates. This is as of today, 11 a.m. Uh, it was 45 million, and this you can see is a big number. Just at 9:30 a.m. today, I checked, it was 45 million, point zero, but as of now, it's more than 85,000 new cases. In a day, we can say averagely it's like 100 cases, 100,000 cases counted in a daily basis. And I was checking in America, on US, the number is really huge. As of today, from CNN, for those who watch the news in the morning, today it has been very worse in United States, more than 83 new confirmed cases. This is the highest number compared to since the pandemic started. So the pandemic started, and I was trying to calculate, comparing and making the difference for the past 5 days. There is an increase of 2 million new confirmed cases just within 5 days. Coming to South Sudan, so the trend is uh, coming down. As of today, it is 2,903 confirmed cases. For the past 5 days, it is only 20 new confirmed cases. And for the last 10 days, I was checking, it was like the trend was going to 30 to 40. So at least the situation in South Sudan is stabilizing, though still we need to take some precautions. And in terms of deaths, globally is more than 1.1 million, and for South Sudan as of today is 50, 80 confirmed deaths due to the pandemic. Now coming to driving life-saving rules. As I mentioned, the life-saving rules way back in May last year, and driving was one of the nine life-saving rules. So in this nine life-saving rules, everyone is engaged and asked to commit firstly to always wear a seatbelt. This is still a challenge. Then avoid overspeeding, avoid using mobile phone while driving. This is for both texting and picking the mobile phone. Likewise, making sure that you are and not under the influence of alcohol. And lastly, for all the journey management requirements. So this is the key message from IOGP driving life-saving rules. Now coming to driving challenges, I think you agree with me that coming to driving challenges for East Africa, including South Sudan, the road condition is not suitable for driving. Of the town, like take example, you're going out of Juba, you will agree that the road condition is really not suitable. So that exposes people to uh, road crashes. Weather condition, when it is hot or it is cold. Here we're talking about the rain season and dry season. Likewise, sometimes when there is any potential risk that it can be resulted due to the weather, like strong wind or earthquake. Then compliance. This comes to our behaviors. Most people take road and the traffic regulations or rules for granted. Then substance abuse, driving under the influence of alcohol. Then poor driving training. If you can see in African countries, getting a driving license is not complicated. You pay cash, you get. It's like we are buying driving licenses. So driving regulations and then driving training are not well controlled. So here are some recommendations. That's I'll take as an example how we adopted in Shrambaje. We came up with the commitment to zero driving accident following all the IOGP driving life-saving rules. Okay, good. So what are the challenges in the pandemic, the COVID-19? As we are very familiar, social distancing remains one of the main challenge, especially in vehicles. How to manage people sitting in a vehicle. I was out last weekend on the road from here in Panorama Hotel going to Regent Hotel. What I saw on the road is really different. It's not like there's no pandemic. In a motorbike, three people uh, just like relaxing and no one cares. The same on the taxis or public transportation, social distancing remains a challenge. The same hygiene in April coming to May, people are very serious, washing their hands, using sanitizers, and all those kind of things. But nowadays, people are starting relaxing, so we are dropping the guards on hygiene. Then the procedural adherence, and then the last one is on the compliance, our behavior. Now, we'd like to share what we made in Shlambaje. We came up with a specific life-saving rules on driving, whereby we have three main elements, and each element has three sub-elements that makes nine life-saving rules. So as you remember, in IOGP, we had nine life-saving rules. So in Shlambaje as well, we come up with the nine life-saving rules divided in three, talking about the COVID-19 prevention and mitigation. And the number one is I assess, mean that we assess our facilities, we assess our behavior and our routine way of uh, working to make sure that we are not exposed. Same, I prevent and then I protect, meaning that taking care of others and making a commitment of saving people's lives. So that's one of the example on managing uh, social distance in vehicles. Now coming to the challenges, as I mentioned, when it comes to how we manage, like wearing the mask or buckling the seatbelt. Some you may have experience in your organization and in your daily life. How do you think? What is your overview when it comes to compliance? In your organization, for sure, you'll find people comply because they're on duty. So someone is monitoring. But how about home, out of the office? Are people still complying? And this is the major gap whereby we have to come up with a plan whereby we'll be helping people not to comply with the reason that I'm just doing this because someone is watching me. People should take this as a part of life. Okay, so I would like to quickly share about the driving smart principle. In other organization or companies, you call it advanced driving. So we have six main principles or techniques. And number one, that starts with S, that's the search to the horizon. That means while driving, we have to search or make sure that we see as far as possible, identify any potential hazards and take appropriate action. And number two is M, that stands for maintain space and visibility. While driving, we are recommended to create enough space that we call it 360 to make sure that we are not exposed in any unexpected crash. And A stands for always move your eyes. That means we have to always check our side mirrors, look on the left, on the right, check the windows, check the mirrors, and this will help us to avoid any crash. And then we have the first R, that's and the second R that stand for recognize and respond. That's all about communication. We have to take care of others, and then we have to respond in a friendly way. Avoid driving harshly, and this will help to use the road friendly and avoid any crash. And the last T, that stands for take control. Take care of pedestrian and other road users or any uh, adverse road condition to make sure that we drive within the limited space, speed and all those kind of things. So that's all about the drive smart. So at the end, I would like to hear from your experience, how you manage it yeah, in your organization and in our daily life. So that is about drive smart. Good. Now let's come to preparation for both driving and the COVID-19 pandemic. So normally, as HSE principles, we do recommend to have a plan. Planning is a key prevention, mean that taking all the precautions, engaging the team, make everyone aware of what is the risk, then planning, and then do it, and then check, mean that assessment, doing risk assessment by doing the follow-up. And here are some words of wisdom from Albert Einstein. As you can see, he comments, whenever addressing any issue, we have to spare more times. So he recommends if we have 1 hour, we have to spend 55 minutes just for planning and then 5 minutes for taking a solution. By doing that, we'll be addressing all the root causes of accidents. And for sure, this is what he addresses as per Albert Einstein. Now let's come to some recommended risk management approach. Number one, having driving policy, then setting the objectives, the KPO, and have the standard that will guide us on how to manage it and take care of all the driving policies and objectives. Number two, driver training and certification. This is a big gap whereby we have to incorporate both training and COVID-19 awareness. Number three, driver fitness. That means we have to go for medical checkup for all the drivers and anyone driving. And then for drivers, we recommend to be annually, then check on substance abuse, and then coming up with fatigue management plan. Number four, improvements and monitoring systems. That includes technology like video, in-vehicle monitoring cameras, green load application, and software that's for self-coaching and monitoring. Then risk assessment for both driving in the COVID-19. That will refer to how we can uh, re reassess and come up with a better plan for taking control on both COVID-19 and driving. Then introducing the culture of risk identification report. Thus, we have to reinforce anyone who see any hazardous situation has to report it to the management or to supervisor or manager so that the hazards can be addressed. And the next one is recognition scheme. For those companies, I'm sure some companies already doing recognition programs to acknowledge and appreciate and reward the best performers. So we do recommend this as part of engaging the team. And the next one is incident and accident investigation. For sure, whenever investigating any incident, it helps to come up with the improvement plan by identifying all the immediates and the root causes. And the next one is audit and inspection. This also helps to identify the gaps. And the next one and the last one is management review, having a culture and a good practice of reviewing our performance and then coming up with the improvement plan. Okay, so if there's any question on risk management, because this is very important, if there's any challenge at your organization or to your company, then this will help us to come up and explore some other options that you can come up on how we can manage driving and the COVID-19 risk. So we'll be happy to hear from you at the end. Now let's come to driving and the COVID-19 risk control hierarchy. As you are very familiar, we are talking about taking control for both the COVID pandemic and the driving risk. So starting with the elimination. So we can have a good practice. If you remember way back in the, March up to April, most of the offices were closed. So we chosen to eliminate the risk. We stop coming in the office or at work. So stopping any work-related movement. And on driving, we can choose on stopping all unnecessary movement. That is on elimination. Coming to substitution, on allow only the staff to board the car, mean that stopping all strangers or giving light to some other strangers. And coming to driving, use only approved vehicles that fit for purpose. And coming to isolation, we can have an example like applying social distancing or work rotation rather than having all people being on the office at once, and this was practiced. Coming to driving, speed governors and all other fittings in the vehicles. And coming to engineering controls on the pandemic, good example, installation of washing stations, sanitizers, mobile phone applications, and on driving, installation of vehicle monitoring devices, as we mentioned, the videos or using the technology like a green load. Then coming to administrative controls, we have COVID-19 risk assessments, having a plan, procedure, and the processes. That would be the same on driving, having driving standard, policy, procedure, processes, having audit and the vehicle inspections. And on PPE, though As very aware, PP is not our last line of defense. This should be the last, as you can see here on the hierarchy. So for pandemic, use the mask, gloves, and face shield. And on driving, for sure, seat belt. And if necessary, using gloves. So here we have a word of wisdom from Travis that says, if you think safety is expensive, try an accident. So if you see all these things cannot be implemented in an organization, now you have a choice. It means that you make a choice to yourself to go for accident, and then you will see how it is expensive for you. Now, I would like to finish with key takeaways, and then I will hear from you. Key takeaway number one, safety culture saves lives. Want to hear from you how you manage to implement safety culture in your organization, and hear some witness from your organization. Is it really helping and saving lives? And this would be good to hear more from you. Takeaway number two, proactive approach is a key prevention of accident and incident. I'm talking about both driving and the COVID-19 pandemic. So we need to address it in a proactive way, not waiting till things goes out of control. And the key takeaway number three, this comes from the word of wisdom from Rick Connor, the coach on leadership. He says leadership is whereby we lead by example, mean that say it, do it, coach it, and live it. We should not just say, oh, because I'm a manager, because I'm the boss, I just tell other people to do it. So we better do it by example, mean that we have to be in the front line to make it, and then people will easily learn and adopt and comply from our actions. And the last key takeaway, we are what we repeatedly do. Excellence then is not an act, but a habit. This is a very big word of wisdom from our for sure. When we take safety culture as part of our life, it becomes our habit, it becomes our DNA. But when we just do it on papers, on standards, on policies, and then when we are back home, we forget about it, we are not helping or supporting organizations. So we have to live safety. We have to make it part of our habit. Now, that's all from my side. Thank you very much. Hopefully, you got something that can help you. Now, I would like to get back to Edwin and Benedict to open the floor for questions and answers, and mainly learning from each and everyone. Thank you.
Okay, thank you so much, Mr. Gideon, for these great presentations. To me, I learned a lot, and I hope most of our participants has also enjoyed this lecture or these presentations. And now the channel is open for everyone to ask and share his thought on the presentations. There is one guy here. It's called Peter Mayom. Mayom Atem. From the previous question that you asked, why this webinar is important, he said here that COVID-19 is there to stay. So it is everyone's responsibility to adapt and to find a new ways to continue business as this becomes the new normal. So this is what Peter Mayom just posed earlier. And I don't know for the rest of the participants, please, if you have any question, you are free to ask, and our presenter is there to answer your thought. If you also want to share anything, feel free to share. So, Mr. Shia, are you there?
Yeah, I can hear you. I'm actually trying to allow all the people to speak. So whenever you feel like you have something to share, you can unmute yourself and go ahead and share it.
Thank you.
Yes, hi everyone. This is Peter. Good evening.
Yeah, good evening.
Yeah, this is Peter Mayom calling from Poland.
Oh,
Guys,
Peter
this
Mayor.
great presentation. Yes. Yeah, Chief Godian, this is a good presentation. And looking at the ways in South Sudan, for example, a country where you can see 3 people on the border, others are just confined. Is there any best way that we can really help to intervene? You know, if we can really put this awareness at some section. So is there any plan? Because we have this presentation in Zoom, so we have joined in. By then, we have many South Sudanese or populations at Juba area. Can we? Is there any way that we can really plan in order to sensitize or help people really understand the dangers of driving? Thank you.
Yeah, Peter, thank you very much for your good question. So I will share my thoughts, and then I will allow SPE readers and the other members to share as well. So for sure, when it comes to driving and COVID-19 pandemic, this is a shared responsibility, whereby the expectation is having all companies, especially the bigger companies, which have the capacity and the resources to extend their initiative to reach or outreach the community. Because this will not help when we are good and we are sharing the services with people who are not good. So I agree with you. We need to come up with a plan, uh, have a budget to extend and have some programs to engage the community. And then we can easily do this by engaging as well government authorities like the traffic police and the health authorities. Like one campaign, like we take for Shrambaje, we say this month is a campaign for uh, driving awareness or COVID-19 awareness, and we do this in the community. So this will help. And then the other side, I would recommend to SPE is the light platform that you can also try to sensitize and come up with a plan. We have some members, and this is one of our social responsibility. So that is my input. I will take it back to Edwin and Benedict to share the overview. Thank you.
Hey, Godian, thank you for this contribution. It's actually, we will take these notes, and it's one of the programs we are looking into in during our term, for at least like bringing all the companies, oil and gas companies, to at least contribute towards the as a social responsibility towards the community. So this is a good contribution. We'll take the note on it. Is there any more like questions? You can go ahead
Yeah,
and unmute yourself.
yes. Hello, hello. Can you
Yes,
guys
go
hear me?
ahead.
Yes, yes, we can hear you. Is this
Okay,
Godfrey?
great. Yes, this is
Yeah,
Godfrey.
welcome.
Yeah. Thank you, Mr. Gideon, for the wonderful presentation. We really enjoyed it, and we've learned a lot through it. My question is it's a bit uh, different. I'm looking into a family setup. When it comes to organizations, usually when we're using company cars, there's certain rules that you guide. But when it comes to the family setup, is there a best practice that you could advise when a family going out? Do they have to all wear a mask when in the car, or is there any other thing that a best practice that can be adapted for such situations? Since we are still in the pandemic period.
Yeah, thank you very much, Godfrey Soma. Yeah, your question is very valid, and this is a challenge. So when it comes to organizations or companies, when we are in-house during our working hours on duty, we comply. But the challenge comes when we go back home. So this will not help. So here the key challenge is habit, mean that we have to adopt the habit, and then as we are planning and budgeting for our families, we have also to budget for the resources like the uh, sanitizers, having the mask for the family. Because if you have a sanitizer, you have a mask while you're on duty, but you are going back home, you meet with your loved ones, they are missing the resources, this will not help. So Let us take this as a challenge and a key takeaway for everyone to share back with our families and then support them when we are needed for a support. So it's very important. Thank you very much, Godfrey. Maybe Edwin and Benedict can add more.
Okay. Anyway, Mr. Gideon, thank you so much. To me, I think everything is okay with me, and since I'm here to actually try to see, as far as the lecture is concerned, everything is okay with it. With the participant here, I'm not seeing anyone again. I'm not seeing any question on the chats here, and I believe if anyone still has more question to ask, we still have like 15 10 minutes to go. Or if you feel like it is okay, you don't have any question anymore, then I will give a floor to Mr. Shear so that he can wrap up our sessions.
I think Baggy Mary
So,
is raising her hand. She can.
Bag Mary?
Oh, yes. Good evening, Chief.
Yeah, good
I'm
evening.
kind of like in a very noisy place, so I don't know if you can hear me clearly.
Yeah, we can hear you. Can hear you.
Okay, thank you. So I really like the presentation. Since I saw the presentation that was going to happen, I realized that it was something like that is very important and very paramount, especially to our society and the environment. And the main reason why you need to find this like to be quite crucial, I'll tell you. Yesterday, I was just driving, like, actually I was being driven, not me driving. So I was moving like from the airport to my residential place, in Gudele. So what happened is, like, along the way, before I could reach home, because I stay in Gudele 1, I witnessed over, at least, if it was less, at least 4 accidents, you know and all these accidents, in the way that it happened, you'd realize that probably people are not paying attention when they're driving. They do not focus on the road and all that. So I found this lecture in particular is really very important, and if we take it into action, it will actually help us a lot. So, and also one thing I would like to comment about is the aspect of the habit, as Chief Godian has said it. Sometimes we find it difficult and we think that it's impractical because we haven't, tried it out. But eventually, when we start trying it, like at home, and, encouraging everyone, it eventually becomes a habit. And then in that way, we can be able to drive safe and keep in a safe environment, and also keep our family safe. So mine was just a comment and not a question. Otherwise, thank you so much, Chief Guardian.
Thank you.
yeah, thank you, Mayor. So, ladies and gentlemen, you can imagine just in one day, yesterday, Mary witnessed the 4 road-related accidents. So you can imagine. So it's really a big challenge that we have to extend our initiatives to the community. This will help, and for sure we'll be doing or performing our social responsibility. And this one, as I mentioned, we are ready. If there is a need from SPE platform, we can work together. And for Shilambaja side, we plan with our country manager and all the resources that we have. We can come up with a plan working together with SPE to outreach the community. This to South Sudan and Juba particular. Thank you.
Thank you very much. Thank you.
Allow me to give a chance to Alex Ngoba. At least I just want him to comment on the side. We know that like for instance in Kenya, there are a lot of borders as well. But compared to South Sudan, whereby we have a lot of accidents, what's the different procedures that maybe the traffic police in Kenya is taking to minimize the number of the accidents compared to what we have in South Sudan? Alex, you can contribute through this comment. Can you hear us,
Mr.
Alex?
Alex? Okay. Yeah.
Can you hear?
Alex, are you there?
I think Alex has some connectivity issues.
Maybe. Yeah, network is sometimes not okay.
I think Victor is raising his hand as well. Victor, you can go ahead and ask your question. Meanwhile, we will wait for Alex. Victor, you can
My
unmute
name,
yourself. Yeah.
I think he's also facing some challenges. Maybe Edwin, can you give companies to hear from their side on how they manage driving into the pandemic?
Who?
I can see we have some other people here.
Yeah,
So
we have like security here putting some good suggestions on the matter. He says here, I really love the presentation. I have learned a lot from it, and if possible, let's have these kinds of presentations at least once or to obtain more like quarterly. Yeah, this one is for the section. We thank you so much, Mr. Sokiri. We welcome your opinion and we appreciate. And Alex here seemed to be experiencing the problem with internet, so we can hear him, and he's here actually asking if we can hear him. So I don't know. So Mr. Chair, can you come in?
All right. So I think meanwhile, I would like really to appreciate the effort put in place to prepare the slides and to allow we just give actual Godion a short-term notes, but he managed to make it, and we can see the visuals and the presentation skills are all excellent. This is from my side, according to my rating. And for the audience later on, once the this webinar ends, you will receive a survey. Please try to rate the presenter based on the questions in the survey. And on the same notes, I would like to thank as well Schlumberger management for allowing Mr. Gordon to have time with us and for the good suggestion on the way forward. So I would like to give appreciation to all Schlumberger employees, including Mr. Gills, who is in the call. And I would like as well to give thanks to Dr. Hosham. Hosham actually is like one of the officers in Sudan section, and Sudan section actually won the 2020 Presidential Outstanding Award from the SP International. So Dr. Hosham, you're welcome to our sessions. And we are looking forward actually for more, upcoming webinars. I would like to thank as well the officers, Mr. Benedict, Mr. Godfrey, Mr. Adam, Ms. Baggy, as well as Ms. Nora. So all those are the part of the officers for SP Juba section 2020 to 2021. With that one, I'm really thankful for all the contribution from the audience and from the presenter. And we are looking forward to see you in the near future. I'm sure that this is not going to be the last time, Godian. We would like to see more and more from you. And let's try to implement those things into our real life, at least to minimize the risk. And we continue to live safe during this pandemic. Thank you, Benedict.
Okay. I think to our participant also, thank you so much. As our chair has just closed our just put his closing remarks. So this one will bring us to the end of the presentations, and I believe you will give us your feedback through the survey that is going to pop up later. So please feel free to give us your feedback because it will help us to improve. Otherwise, Mr. Gideon, thank you so much for this wonderful presentation. We hope to have more knowledge sharing with you later in future, inshallah, for especially with regard to the other topics to do with HSE and others. So thank you so much for that.
Okay, thank you very much.
Thank you so much for your time. Thank you.
Okay, bye.
Bye.
Thanks. Bye.
Thank you. Bye.